I am Dr. Tanmay Chaudhary, arthroscopy and sports injuries consultant at V One Hospital Indore. Today we are discussing common knee injuries, as I am a knee and a shoulder surgeon operating in Indore for more than 15 years. And a lot of patients we do get in day-to-day practice of common knee problems, whether they are because of the injury due to twisting injury or fall while playing sports, or from two-wheelers, because we have so many two-wheelers nowadays and running at high velocity. So mostly they are because of the two-wheeler injuries, or there are other set of patients who have knee pain other than the injury. Even without the injury, they have these knee problems. So what are the common knee injuries we come around? Mainly it is the anterior knee pain. So let's start from understanding the knee structure, how our knee is formed. So this is the right knee model. We are looking from the front. This is how it looks from the sides, from back, and from the other side, the outer side and right back in the front. So this is the 360-degree view of the knee. So mostly, and this is the thigh bone, this is the leg bone below the knee, and this is the kneecap bone, which we call as the patella bone. Mostly the pain what we see around, if it is without the injury, is mostly around the patella bone, which we called as anterior knee pain, and it is mostly because of improper workout, improper training, and lack of exercises, proper stretching exercises of the knee, and proper strengthening stretching module. So if there is imbalance between our hamstring and quadriceps muscles, this is the usual case when the patella gets tight and it hits over the condyle. So it rubs over the femoral condyle here, and that's why the knee pain is mostly generated. This is the most common knee pain which we get in our OPD patients. Now, as we come to the injuries, so most common knee injuries of the knee are either of the ligaments, or because of the twisting, either because of while playing sports or because of the two-wheeler accidents. So when there is a two-wheeler accident, as we see, mostly what happens is there is a valgus kind of, when you land up, probably the knee twists like this, or it suddenly twists like this, or there is an hyperextension of the knee. So these kinds of injuries, when there is sudden torsion and twisting in the knee, the ligaments, these are the four ligaments, I would say. Main four ligaments of the knee are the medial collateral ligament, which is called as MCL. Then there is the lateral collateral ligament here, and also the posterior ligament as well, so which we form the posterolateral complex. Then there are two main ligaments called as cruciate ligaments, the anterior cruciate ligament, which we can see here, and there is another on the posterior side, the posterior cruciate ligament, what we can see here. So the most common injured amongst these four is the anterior cruciate ligament, which is this ligament, which gives way very fast, and most of the patients in any kind of sudden twists or sudden bending or sudden extension of the knee. So this can happen. So this is the most common injury of the ligaments, one of the most common out of the four. Then depending on the velocity of the trauma, velocity of the injury, the other ligaments can also be involved along with the ACL, the anterior cruciate ligament. Now, depending on the type of force applied, when we apply a force, probably if the force is like this area would go away and would allow this ligament to get torn from the femoral side or from the tibial side, depending on the velocity of injury and the type of vector forces applying on the knee. Along with it, probably at times the anterior cruciate ligament also tears off. So this would comprise of the multi-ligament knee injuries. And there are the posterior cruciate ligament and the other lateral collateral ligament. These are also get injured at times.